Mr. Speaker and honorable members, the first strategic principle of the Bermuda Health Strategy 2022-2027 is promoting healthy living and preventative care. As we strive for a healthier Bermuda, living a healthy lifestyle and taking steps to prevent the onset of illness are essential actions in our personal journey towards better health and key to improving our population's health. Mr. Speaker, as I've stated in this House last year, health system change is complex, but our goals are clear. It bears repeating that we must achieve better health outcomes, particularly chronic disease management and mental well-being. We must ensure the availability of essential health services that residents can be confident that they can afford when they need them, and we must strive to be efficient and effective in delivering these services and eliminate waste and duplication in the health system. Mr. Speaker, as we continue our multi-year journey to deliver on this government's promise to implement universal health coverage for all residents, I want to take this opportunity to focus on our own individual roles in the health system transformation that lies ahead of us. Many of us think of our health system as comprising the treatments we receive from doctors, dentists, nurses, physiotherapists, pharmacists, and other allied health professionals, as well as the services provided at the hospitals, health centers, clinics, and laboratories. We think of our health as a product of these health system services, perhaps with an added measure of genetics. But our individual health is more than that, Mr. Speaker. Arguably, our health is largely created through actions outside the health sector. The conditions in which we are born, grow, live, work, and age are fundamentally connected to our physical and mental well-being. While we may not be able to control all of these conditions of life, we can make individual choices decisions which collectively foster health transformation at a personal level and at a community level. Mr. Speaker, what is required by the entire Bermuda community, though, is a paradigm shift in our thinking about health and well-being, and especially our role in the change we want to see. As I announced at the beginning of this month, the Department of Health is focused on promoting good health and will be spearheading the Commit to Change campaign this year. The campaign's goal is to encourage residents to make small commitments towards healthy living. Change is tough and failure can be demoralizing, so we will be asking you to just make one change at a time. These changes do not need to be big, but they do need to be consistent. Small steps help us create valuable habits, and good habits create change. Mr. Speaker, we all know a healthy diet and regular exercise are good habits. You do not need me to tell you that. However, when you do commit to change, just drink a glass of water instead of soda. This is a small step. Park your car or bike 3 streets away from the shop that you plan to visit, or walk to it. That is another small step. Other good habits include a good night's sleep, making time to be mindful, learning something new, and having breakfast. Mr. Speaker, when you notice a friend, family member, or colleague making one small change, we shouldn't tease them. Instead, we should support them, or better yet, join them. And these small steps matter, as they do make a difference. Another adjustment we can make in our lives is to ensure that we get our annual physical, and for women, our yearly mammograms as recommended by our doctors. We can be proactive about our health status. If we can prevent illness and injury in the first place, we can reduce cost in the health system. If we cannot prevent illness, at least we may receive treatment early enough to produce a good result and decrease, if not eliminate, complications later in life. Mr. Speaker, a key change in our approach to health and well-being would be our use of the emergency department at KEMH. Many people view the care received from the dedicated staff at the emergency department as free. It is not free. It is paid for through a combination of our tax dollars and a portion of the health insurance premium of every insured person. As honorable members will be aware, emergency department treatment is one of the most expensive ways to receive medical care, and using it for regular care drives up cost in the health system for all of us. The change you can make is to stop and first ask yourself if your GP can help. Perhaps you can wait until the next day to see your GP. And if you are a GP, does that patient absolutely require the type of urgent medical care that the emergency team provides? We recognize these can be difficult decisions, and particularly for those who are underinsured and uninsured, the emergency department can be viewed as a viable option. A revamp of our healthcare system is necessary to help all residents access care more appropriately, ensure we as a community make the best use of our vital hospital resources, and deliver better value care for all of us. Mr. Speaker, change is a developmental process, and it occurs on a gradient ranging from incremental improvements to transformation. We all have a role to play in the health system transformation, and each step matters. Universal health coverage, or UHC, is a vital part of the change we need to see, and this government remains committed to its implementation. The Ministry of Health, along with key partners in the private and public sectors, have made progress with projects that are priority, which are fundamental for the UHC. One such project is Bermuda's first Joint Strategic Needs Assessment, or JSNA, to manage the island's healthcare system transformation within our financial constraints. As a starting point, Mr. Speaker, we need to know what our priority health needs are, including both physical and mental health. Honorable members will recall my statement last November, which spoke to a strategic principle of the Bermuda Health Strategy, namely understanding our health population's health needs. With the vital support and superb work of public registrars in training with the UK Health and Safety Agency, along with resources kindly provided to us by the Department of Statistics, Bermuda's first JSNA is nearing completion, and I thank them for their incredible efforts. The JSNA will provide a baseline of information on our population's health, and it comprises a review of the following areas. 1, Bermuda's population profile and the social determinants of health. 2, health behaviors and risk factors. 3, causes of ill health and death. 4, vulnerable groups, including children, the elderly, and people with disabilities. And 5, healthcare services. The JSNA's key findings on Bermuda's population profile and wider determinants of health indicate the island's population looks set to decrease size, increase in age, and continue to be characterized by multi-social economic inequities. While this may not be new information, all these conditions will impact health and health care. As stated in the Bermuda Health Strategy, healthcare strengthening has a 10 to 15-year horizon, and it is important to be able to measure our progress. We must know our starting point, as we can only manage what we can measure. We expect completion of the JSNA in early April, and I look forward to publication shortly thereafter. Mr. Speaker, another strategic principle of the Bermuda Health Strategy is harnessing healthcare technology. As noted in that strategy, technology can help improve access to physical and mental health care services. This can also improve how health care is delivered and how outcomes can be measured and monitored. In undertaking the evidence of developing the Bermuda National Health Digital Strategy, a working group set up in October last year aimed to establish a system-wide vision and integrated digital healthcare strategy. Digital health innovation is more than electronic medical records. This form of health innovation has the potential to be a key enabler in the transformation of Bermuda's healthcare system. The working group comprises doctors, insurers, representatives of BHB and the Bermuda Health Council, as well as relevant government departments, and they have met bi-weekly, then weekly since October. In that time, it has engaged Edinburgh Innovations in Interactive Health and collaborations with KPMG to produce a digital health assessment of the workforce and a digital health assessment of the community, respectively. The aim is to complete the National Digital Health Strategy in April, with publication in due course after that. I want to take this opportunity to thank all of the members of the National Digital Health Strategy Working Group for their very hard work in getting to this point. In particular, the efforts of Kirsten Beasley, who chairs the group, and Lori Marshall, who's the project manager, have been invaluable in the process and the progress that's been made to date. Mr. Speaker, the JSNA and the National Digital Health Strategy are vital, foundational pieces of work that will guide decision-making into the future, and I look forward to sharing their full findings and recommendations with this Honorable House. Mr. Speaker, the UHC program of work also includes an examination of our integrated care pathways, and that work is underway as well. The purpose is to review and understand care needs and care provision so that we can identify any potential improvements. With a deep understanding of a patient's journey along a care pathway, it is possible to design a more integrated service model to improve the patient experience, clinical outcomes, and operational performance. The initial care pathways being examined are the first 1,000 days of life, and Dr. Sylvanas Nawab as the clinical lead, chronic kidney disease, and adult acute mental health, with Dr. Anna Nielsen-Williams as the clinical lead. The clinical lead for the kidney disease pathway is still to come. Mr. Speaker, these integrated care pathways reflect another strategic principle of the Bermuda Health Strategy, namely partnerships and collaborative working. As outlined in the strategy, understanding and defining more integrated care pathways between providers and individuals will increase the quality, affordability, and efficiency of care. It will also strengthen the health system by defining standards and promoting and disseminating best practice. And finally, Mr. Speaker, I would like to provide honorable members with an update on the drug formulary. Controlling the cost of pharmaceuticals is a critical part of our health system's financial reform. Our high cost of health care as an aging population and increasing incidence of chronic diseases such as diabetes all contribute to the burden felt by many in the community. Science continues to give us new medicines and treatments for managing our health, but it is clear people are concerned about the price that they have to pay for these medicines. Clinically, pharmaceuticals are medications which are the most effective non-behavioral intervention for non-communicable diseases. And pharmaceutical intervention saves money and interrupts the cost and burden of disease progression by doing so with efficiency, and this does require cost control. The Pharmacy and Therapeutics Committee is up and running and advises the Health Council on the drug formulary where prices will be regulated. The purpose is not to control the price of every medication sold in Bermuda, but rather the Bermuda Drug Formulary will comprise the list of common essential medications along with associated products and devices used in medical treatments, which are intended to be medically appropriate, cost-effective, and sold at a regulated price. So far, the Health Council has placed 2 COVID antiviral drugs on the formulary, and they are priced at $30. Additionally, Mr. Speaker, the committee met this week and approved 4 diabetes medications to be added to the formulary. The committee will deliberate on 2 more diabetes medications very shortly, and the Health Council anticipates publication of the group of diabetes medications by the end of next week. The next group to be considered is insulin, followed by cardiovascular medications. The public is invited to check the Bermuda Health Council's website for updates as they happen. Mr. Speaker, as we seek to answer the question, what does it take to be healthy and stay healthy, not just get healthy, we strongly encourage everyone to execute on those small steps and small changes which are within your control and create good habits. This is within our ability, and that is our personal responsibility. The paradigm shift in our thinking about things like our use of hospital resources, frankly, is very necessary, and Bermuda must revamp its healthcare system, and we all have roles to play. The ministry's commitment to providing the support that we can through our public health services is unwavering, and this government's commitment to healthcare transformation is resolute. Thank you, Mr. Speaker.